I like to tell the patients we're treating them and not the cancer, because everybody's different, every cancer is different, and all the approaches need to be directed at the patient with them involved in their treatment as well.
We moved here from Georgia. It was a scary thing because my first doctor's visit was to tell them that, you know, I have something in my breast. So welcome to Virginia. Not being in Georgia was lonely. All of my resources were there, but you know, the medical family that we made at Mary Washington Hospital and the surgeons and the other doctors, it was truly amazing that they made us feel like, you know, even though we didn't have our Georgia family, that they adopted us.
The kind of care that a woman can get here is the same thing that they'd be getting at some of the larger facilities. We're successful in terms of vast majority of patients in that we're able to treat them appropriately, we're able to follow them, and provide whatever care that they need.
It was a major blow. It was very scary to find out that I was diagnosed with cancer. But then some peace came over me. Most importantly, it was through the healthcare. All I know is that I was diagnosed. I had just lost 2 cousins in death behind breast cancer, and the fear was there. They explained everything. And I'm glad I have my daughter with me because it was so much information. I couldn't kind of like keep up with all of it.
When you get a cancer diagnosis, first of all, you're overwhelmed. And it's nice to have another person to help you through the whole process of understanding. The nurse navigator, I think, is something really up and coming in oncology, and it is tremendously beneficial.
The doctor goes in, tells them they have breast cancer, and then I come in and help them figure out what that means for that patient. I help set up their consult with the surgeon and get the ball moving quickly so the patient isn't left with that diagnosis with the fear of not knowing what to do next.
Pam and Regina, they were my lifesavers. I was crying several times in the office. And it wasn't just that they gave me a tissue, it was that they kind of like gave me a nonverbal hug. It gave me a lot of hope.
Most of the patients that I talk to, the first thing they think about is their children. What I do is let them talk about that and then let them know that we have lots and lots of support services to help them through it, and that I am there from the day that they're told their diagnosis all the way through their treatment as a navigator, navigating them through the confusing complexities of the breast cancer journey.
We have a multidisciplinary approach when it comes to treating breast cancer. The first thing that's going to happen is imaging. That's kind of the most important thing, because most lumps that people feel are going to be benign. They're either cysts, they're fibroadenomas, they're basically not anything. But until you get that imaging, you don't know for sure. If the radiologist says, you know, I think we really need a biopsy, they'll set it up. They'll make the appointment that day. Okay, and sometimes they can actually do the biopsies the same day as they find something. Usually about 2 days later is when the pathology report comes back, and they will have made an appointment to see the navigator. If it's a cancer, the navigator will call my office, and I have agreed to see patients within 3 days, sometimes even the next day, but within 3 days of having a diagnosis, because I think it's very important that they're seen right away.
We got in the doctor's office and they moved me straight to getting more of an imaging appointment. Was diagnosed on a Wednesday and went the next day to meet with a surgeon, and then went in that exact Friday for surgery.
We come up with a plan. I'll talk to them, explain to them what this pathology report means, what I think their next steps should be. Most of the time it's surgery. If we do the lumpectomy, it's an outpatient procedure. I go through the whole 9 yards on what this means. If they need a mastectomy, I have them see one of the plastic surgeons, and then we'll coordinate the surgery with the mastectomy and immediate reconstruction. It do the surgery. About a month or so, if they need chemotherapy, they'll do the chemotherapy next, but they need to heal from the surgery before they get the chemo if they need it. If they don't need chemo, and if they've done a lumpectomy, they'll do radiation, and I'll set all that stuff up for them, for the radiation oncologist. There's a couple of treatment options when it comes to radiation oncology. The standard of care after lumpectomy has been whole breast radiation, and that's typically 6 weeks, 5 days a week. As part of that, the radiation oncologist has started to do something called the AccuBoost program. And the AccuBoost is a very specific way of actually providing the focused radiation. The last 7 treatments are focused on the lumpectomy cavity itself. And that's where the AccuBoost comes in, to where it can accurately deliver the highest dose of radiation. Because that's where, if you're going to have a recurrence, that's where it happens. Mary Washington has spent a lot of time and effort and money on the Cancer Center as well as the breast program. They want patients to know that there are local treatment options.
We were truly blessed to have such a wonderful facility here. It was so personalized, but you still knew that you were getting the best of the best as far as treatment. And to have that right here in our own backyard is phenomenal.
Through all the hospitals I've been through, with the overall list of professional care and love, I again got to say Mary Washington did me outstandingly well. Whether it was through the chemo, the radiation, the surgeon, they all connected. I'm getting great care. Nobody's letting nothing slip through the cracks.
They're not treated as a number. They're treated more as a person, and it's a more comforting, I think, that to know that there's somebody there who knows you and knows what your fears are and can treat you directly. We're all very passionate about treating cancer patients, and I think we have to do it on a personal and empathetic level to be able to understand where the woman is coming from. We have an excellent program here.